Interpreting an X-ray of a foot, normal foot X-ray. Normal foot X-ray. When taking an X-ray of a foot, it is important to be as still as possible. This is because dirt on the foot will show up on the image as a dark spot. The same is true for long walls or overgrown soles. Even an overgrown frog can show up as an artifact. Digital X-rays can also have edge burn through, which can be distracting to the patient. Marking the foot is an important step before a routine X-ray. It is a tradition among many veterinarians to mark the foot, but this isn't necessary for every procedure. If the feet are not marked, this information can be lost on a digital X-ray. The first step in interpreting an X-rays of the feet is understanding the differences between normal and abnormal ones. Normal foot X-ray. The medial cuneiform bones are the most visible on the dorsoplantar view. The medial margins of each tarsal bone must align with their respective metatarsals. The lateral phalanges, as well as the calcaneum, should also be seen on an oblique X-ray. The navicular bone is the last bone in the foot that needs analysis. A normal foot X-ray will show various structures in the foot, including the medial cuneiforms and the medial articulation of the Lisfranc joint. The interphalangeal joints are not visible on a non-weight-bearing X-ray. However, the metatarsophalangeal joints are clearly visible and aligned. Sesamoid bones of the first toe are normal as well. A foot X-ray is a standard investigation for orthopedic problems, including evaluating the structural integrity of a bone. The radiation exposure from the X-ray will be minimal. It is important to remember that pregnant women are more sensitive to radiation than those who are not pregnant. Therefore, it is important to inform the X-ray technician if you are pregnant. Parents can also prepare their children for the procedure by explaining what the X-ray is and how it will help the child feel comfortable. X-rays of the foot are considered to be safe for children. Normal foot X-ray. The radiation dose used in the procedure is low and poses little risk to healthy adults. But it is more dangerous for developing babies. Because of the high radiation doses involved, pregnant women should inform the X-ray technician of their pregnancy to avoid being exposed to radiation. A child should be prepared for the X-ray by being informed and being prepared. An X-ray of the foot is a valuable tool to diagnose orthopedic problems. It can reveal the cause of many common symptoms, such as fractures or dislocations of joints. It is also vital for determining how bones aligned and healed after surgery. It can also be used to evaluate the success of a surgical procedure. In some cases, an X-ray can reveal tumors, cysts, and later-stage infections of the bones in the feet. An X-ray of a foot is a simple, safe procedure. Normal foot X-ray. The exposure to radiation to the feet is minimal and should not pose any health risk. The X-ray technician should be aware of any pregnancy. Moreover, a child should be aware of the process and know what it entails. It can also help her prepare for an appointment. It is very important to inform the child about the procedure and what it will look like. An X-ray of the foot is a basic investigation for orthopedic problems. A doctor may order an X-ray of a foot if he or she suspects a condition. The X-ray will show the medial and lateral elements of the foot. The navicular bone is not visible on a normal foot. Moreover, he or she will be able to tell whether or not the medial articulation of the joints is normal. The X-ray of a foot is the most basic investigation of a foot. It is the first step in a treatment plan. It can help determine whether the condition is treatable. Often, it will be possible to diagnose a sprained ankle by examining the feet. The X-ray will help the physician diagnose an underlying problem and treat the symptoms. If the X-ray is abnormal, a doctor will prescribe treatment. Normal foot X-ray, normal foot Xray, normal foot Xray.